Hello, Lana. This is AHUURA RUDIA, a teacher at MBARARA Junior School, a teacher of science, handling science in P5 class. We are going to have our lesson basing on human health. And under human health, we are going to talk about primary health care. And then still under primary health care, we are going to talk about elements of primary health care. But before we come to our today's topic, we have to remind ourselves of some health promoting activities that we learned in P4. I am very sure these will guide us to understanding of elements of primary health care. Or this will help us to know more about primary health care. First of all, we have these usual activities which we do daily. Most of us, at least brushing the teeth. At least we do this every day, especially after meals. Washing clothes. We all know that we are supposed to wash our clothes. Immunizing children. Most of us, I am very sure, when we are still young, we're immunized against some diseases. For example, measles, polio. And in fact, we had this topic last term 2. In P5, we handle immunization. So you know what immunization is. Am I very clear, Mylana? Yes. We have proper disposal of human feces. This one is a very, very good activity which helps to prevent diarrheal diseases in our community. Then lastly, we have sweeping rubbish in the compound. We have always done this, even sweeping our houses, and then also bathing. A normal person is supposed to bathe, and I know you always do this. Now, still before we go to looking at primary health care in details, there is a scenario I want to bring. In some village in our area there is something which happened some time back. Children, especially boys and girls, we are suffering from diarrheal diseases frequently. In other words, health workers had a problem of treating boys and girls, whoever would be brought diarrhea, typhoid, cholera, things of the like. And it was also realized that in this area, these people had one open water source, which water source was used by both animals and people. There was nobody to protect this water source. People would defecate there, children would urinate there, animals would drink water from there. In other words, this water source was not protected at all. And therefore, this was connected to the rampant breakout of diarrheal diseases in this area, especially in the young children, boys and girls. Now, one community leader thought and was like, why can't we involve health workers to come and help us on this? Then he went and saw these health workers and then agreed on a certain date to come and meet the people of this given area and then discuss health issues with them. So the day reached, the health workers came. First of all, the first issue at hand was to address the other water source, where people used to collect water and drink without even boiling it. In other words, people would drink water which is not safe for drinking. Safe water is that water free from germs. People wouldn't boil water for drinking from this source. They would just collect and then drink. In the end, they end up suffering from the diarrheal disease that we have talked about. Then still, in the same meeting, these health workers talked about very many things. They advised people on always ensuring that their children are immunized. These health workers were also able to advise people on keeping personal hygiene practices, to always mind about keeping their bodies clean, that is. Then also people in this meeting were taught how to give first aid in case somebody got an accident. They were taught on the importance of giving first aid, how it would save people's lives, how it would improve on people's health. So people were taught how to give first aid. And still in the same meeting, people were able to learn about family planning. Because If a parent just produces aimlessly without proper spacing, without putting in mind the way how to take care of these children being produced, it also becomes a problem to health. Because this person will not be able to, for example, if the children fell sick, this person wouldn't be able to provide medical care. This person cannot even be able to provide a balanced diet. So people in this community were advised to practice family planning. Then lastly, in this same meeting, people were advised to always respect this practice of oral hygiene, oral and dental care, to keep the mouth clean, the teeth and what, so they were advised. Then, to cut the story short, after this meeting, after some months, like 5 months or 6 months, it was realized that the level at which children were falling sick, were suffering from diarrheal diseases, reduced. Why? Because of this meeting which was held by the health workers and the community members. Now, learner, my learner, basing on my scenario, because when I was starting to give you my scenario, I said, listen carefully, and at the end of my scenario, I will ask some questions. Do you still remember, according to our scenario, which problem this community faced? Yes, I know you still remember. The thing is, in this area, there was frequent breakout of diarrheal diseases. Then another question is, what do you think would have helped to solve this problem in this area? As you continue to think, I know you'll get the answer. I think it is because of the intervention of these health workers that people came together. They organized themselves and then had to do all what the health workers told them. And then we came out with this good result of reduced numbers of children falling sick of diarrheal diseases. Now, my learner, basing on the scenario and the health promoting activities that we talked about when we are starting this lesson, now we are coming back to our lesson. Those activities these people were told to do, to follow, as a group, first of all, as an individual, these activities, for example, first, we said the health workers advise these people to always carry out first aid. These people were told to mind about immunization. These people were also told to mind about personal hygiene. Again, these people were told to mind about, to carry out what we call family planning. And then lastly, these people were told to mind about dental, oral, and dental care. Now, these practices, all of them, these practices and many others, are the activities which make up what we call the elements of primary health care. An element is something which makes up another thing. So when we say elements of PHC, we are trying to talk about what are these practices that can bring out what primary health care. These are elements, some of the elements of PHC. But again, somebody can ask him or herself, what is this PHC? PHC is an abbreviation of primary health care. If you don't want to say primary health care, it is primary PHC. So PHC in full is primary health care. But then somebody would like also to know what primary health care is as far as definition is concerned. How do you define it? If somebody wants to know what primary health care is, what do you say? Now, primary health care, looking at what we have just seen, this is an essential care. PHC is essential care where individuals, families, and communities come together, and communities come together to solve their common health problems. Like we said in the scenario, the health workers advised the people of this community to come together, think about, for example, constructing pit latrines. This would enhance proper disposal of feces. In doing that, diarrheal disease would be prevented through the 4F's jump path. These people encourage the health workers encourage these people to take their children for immunization. So these people agreed, and they were able to do what the health workers told them. So they came together as individuals. For example, like as an individual, it is you to decide either to bathe or not to bathe. So as an individual, you have a role to play. As a family, you have a role to play. For example, if you have children in a family and you say, for us, we shall not take children for immunization, then it means that one would have been a role of the family. But if the family says, fine, we should take all our children for immunization, then the family will have participated in promoting this primary health care. Then also as a community members are supposed to be so keen to help each other. If they say, we do this, let's always take our children for immunization. You as a community member, have you helped your friend? Have you helped your neighbor to do what is supposed to be done as far as promoting health is concerned in your area? So PHC is done by individuals, families, and also communities. And therefore, my learner, for today, our main intention was to look at the elements of primary health care, and then also basically we look at the definition of primary health care. And here are some of the elements. This one is first aid, we have immunization, we have personal hygiene, we have family planning, then we have oral and dental care. Now, during your free time, Mylan, I'm talking to you, during your free time, I want you to organize on each of these elements. You form two activities which you think can be done by you as an individual to promote. For example, first aid, what can you do as a learner, as an individual to promote first aid? I can guide you on this one. If somebody got an accident, are you able to help? Participate in giving first aid. Learn more about the skills of giving first aid. I am just tipping you on what you're supposed to do. Then, when it comes to immunization, still, look for 2 points. One, you can remind your parent of the next date of immunization of your sibling. You will have played some role. Also, you accept to be taken for immunization, you will have played a role. I want you to give two activities you can do to promote this. Personal hygiene, what can be done? 2. Family planning, this one, no. Don't talk about this. First aid, immunization, and then personal hygiene. With that, I call the lesson to the end. And then, in our next lesson, we shall look at different activities individuals, families, and communities can do to promote primary health care. After doing this exercise, drop it in the comment section. I'll be able to give feedback in our next lesson. Thank you.